Dr. Deom here at Hazleton, Stroudsburg, and Pottsville Eye Specialists. Very excited to be with you here today live. I'm live. I might not be live to you, but I'm live at our new location in Pottsville. Very exciting. So you're seeing the beautiful sparkle accent wall you're going to be greeted to when you walk into our brand new facility. Beautiful new chairs, beautiful surroundings, large optical area, ready and waiting for you, your loved ones, your entire family to provide you the very best in eye care here at Pottsville Eye Specialists. And you all know our other locations in Hazleton. We're 281 Airport Road on the Airport Beltway in Hazel Township, PA. Give us a call there, 570-453-2020. And our office, which I guess isn't our new office anymore, in Tannersville, Stroudsburg Eye Specialists, right off of Route 611 behind the Friendlies, right down the street from the outlet. So go do some shopping and check us out and get an eye exam at our beautiful location in Tannersville. And of course, here we are now at our beautiful location in Pottsville. Brand new staff, new technology, and you're really gonna love what we have here. So we are very excited to talk to you today about something that I think is something I hear about every single day, and that is, Doctor, I'm taking this new medicine and I was told that it can affect my vision. I was told that it can cause glaucoma. I was told that it can cause dryness of my eyes, irritation of my eyes, and this is something that's very important that we review. And so there are some common ones that we think about, and there are some that are much less common, but I want to just kind of review why it is that you probably cannot listen to a commercial on TV and hear a medicine commercial without hearing that it may cause vision problems or eye pressure concerns or could cause glaucoma. And really the reason for that is whenever there's a new medicine that comes to market, they're always going to evaluate the eyes and the structure of the eyes and vision. And it's unlikely, as a result of just the normal percentage of people that have eye or vision changes throughout the day, most likely from eye dryness, that in a given population of people being studied for medicine, there's probably a high likelihood that there's going to be a number of folks that answer the question, has your vision changed at all? That some of them are going to say yes. So my first response that I always give to a patient about whether or not they should be worried about the medicine is, I want to first explain to you why it is that sometimes people deal with vision changes with a new medicine. It might have nothing to do with the medicine. It might have just gotten thrown in to the package insert, which is that little tiny piece of paper that nobody could read in a medicine box or medicine bottle, or the fine print at the end of a medicine commercial. So it might have just got thrown in there because lots of people deal with vision changes and visual concerns, dry eye, and when they have a new medicine, this is a question they ask all the time. It's naturally want to know if your eyes or vision have been changed. The other big reason is that lots of medicines work on our nerve function and our blood pressure and regulate vascular changes and vascular events in our body. And so the eye happens to be one of the most highly innervated, which means there's more nerves per square millimeter in the cornea, the front part of the eye, than any other part of the body. And it's a highly vascularized tissue also, which means that there's a ton of little tiny baby blood vessels inside the eye, and in particular in a part of the eye called the retina in the back of the eye. So anything that has an effect on our nerves or our blood system like high blood pressure medicine that will lower blood pressure, or in nerve function. Anything that has an effect on those things can have an effect on our eyes. And the other thing to think about, which is a huge category of medicine, is the medicines that affect our water retention. And when I say water retention, you probably think about a water pill or a diuretic. And of course, diuretics or water pills are going to make us lose water and create dryness. And so there's a huge category of medicines, various mechanisms that can cause dryness. So those are the main categories that I think about when I think about what type of medicine can have a realistic effect on our vision. I think about medicines that affect our blood and vascular system. I think about medicines that can affect our nerve function. And I think about medicines that affect whether or not we retain or release moisture, and that could really have a big effect on the comfort of our eyes, and subsequently the comfort of our eyes with contact lenses and the clarity of our vision. So those are the big categories I want to kind of think about. As we review this discussion about medicines and how they affect our eyes, I want you to think about how important it is to carry around with you and be aware of the medicines that you're taking. One great thing that you could do to help us provide the best care to you at any one of our locations is provide us with a really up-to-date list of your primary care doctor and location, any contact information. Certainly we could Google that stuff, no problem. It's great when you help us out and bring it in. And then a list of the medicines you're taking, how often you take that medicine, and what milligram or concentration that medicine it is. So that's really, really helpful and very important that you bring that to us because while you may think, hey, we're eye doctors, we're checking you to make sure you're seeing well, we're getting you glasses and contacts, what do they need to know, what kind of medicine I'm on? Well, it's actually very important, and that's what we're talking about here today because it can increase the likelihood of many different eye conditions, and that's what we're going to learn about here in just a few moments when we come back for our break. So stay tuned and we'll be right back. Buddy, Dr. Deom here at Hazleton, Stroudsburg, and Pottsville Eye Specialists, and we're here in our beautiful new Pottsville location. I'm very excited to show you a little bit more of our Pottsville location, and today we're actually talking to you about medicines that affect your eyes and what they affect and how they affect your eyes. And I know you've heard on TV, this medicine may cause you blurry vision, it could cause glaucoma, so that's what we're learning about here today. Don't forget, we're in Hazleton on the Airport Beltway, 281 Airport Road in Hazleton, and also in Tannersville, right behind the Friendlies on Route 611. Give us a call there, 570-452-3342. Check us out there also. So come on here, I want to show you some of this new technology that we got, and I have this great new device I want to show you here too. So this is one of our pre-testing rooms here at Pottsville Eye Specialists. So I wanted to show you some of the technology real quick because we really are very excited to have some of the top of the line stuff here. This right here measures the shape of the front of your eye, gives us an idea of what kind of prescription you may have, if you're nearsighted, farsighted, have astigmatism, and it also checks your eye pressure. So it's a really great multi-purpose, multifunctional tool. It even tells us a little bit about how your tears break up on your eye. This is a really great device right here. What this does is it takes a picture of the back of your eye, really a huge angle picture of the back of your eye without having to dilate your eye. It's called an optos, and we love having this technology here at our office because it really allows us to provide the highest level of care to you and your loved ones. This silly hat I had on here is actually a really very technologically advanced device called a dark adaptometer, and dark adaptometry is the measurement of light and dark adaptation, the ability of our eyes to adapt to light changes. So if you're in a really light room and you go into a dark room, it takes some time for your eyes to adapt. And if you're in a dark room and go into a light room, likewise, it takes your eyes time to adapt. And that time it takes to adapt is connected to how many healthy cells live in the back of your eye. So we can measure that with this really cool virtual reality-like device, and it actually can show us early signs of macular degeneration, a potentially sight-threatening, vision-stealing condition. So some of the great technology we have here at Pottsville Eye Specialists. So let's get back into our discussion about medicines and how they affect our eyes. So I brought my notes from optometry school here with me, so I'm going to share some of them with you. So I think some of the biggest ones that we think about when we think about medicines and how they affect our eyes are the antis. I classify them as the antis. So our antihypertensives, the ones that end in olols, those ones. Really any of the antihypertensive medicines, even some of the others that do different things in our body. A lot of times what these medicines do, if we have too much pressure in our blood vessels, they act to decrease that pressure many times by getting rid of fluid. So a diuretic is going to be an example of that, as well as something called a beta blocker. These things are going to affect our overall moisture in our body, thereby changing the moisture on the front of the eyes. So lots of times I have patients that come in on medicines for their hypertension or high blood pressure, which is a very serious and potentially life-threatening condition, and notice that all of a sudden they have eye dryness. And so this is, I would say, one of the biggest ones that we run into. Not a reason to necessarily stop your antihypertensive medicine, but I definitely think it's something that you should know about, something that, you know, could help kind of put the pieces of the puzzle together, why you're experiencing dryness after you started taking your hypertension medicine. Number 2 on the anti-list is our anti-allergy medicines, okay? So we think of anti-allergy medicines, big category of anti-allergy medicines are antihistamines, okay? And antihistamines, what they do is they stop a chemical in our body from spreading, something called a histamine. Histamines are released from an immune cell in our body called a mast cell. So what happens is an allergen is recognized in the environment by our body with these little hands on these cells. So you have a cell and the hands on the cell attach to the allergen and cause the cell to open up and spit out all this thing called a histamine. And so the histamine causes redness, swelling, itch, and those are the things we associate with allergies. So what happens with an antihistamine is it stops the mast cell from spitting out the histamine, and then some medicines even have something called an antihistamine in it. So a mast cell stabilizer and an antihistamine. So mast cell stabilizers stop the mast cell from degranulating the histamine, and the antihistamine is binding the histamine so we don't get the allergy. So what they also do is they decongest us. If we feel kind of clogged up or, you know, feeling like we're swollen in our sinuses, anti-allergy medicines will decongest us so that we feel less congested in our sinuses and even on our eyes. But at the same time, decongesting our sinuses are going to decongest our eyes and cause them to be dry. So another big category of the antis, something that causes dryness, is an anti-allergy medicine, and that's why it happens. The third on the list of the antis that I want you to be aware of is an antidepressant. Certainly depression, very serious condition and thing that we need to be aware of and address. Potentially mental health issue that, if not treated, can lead to many detrimental things in ourselves and in others. So very serious, and I'm not for any minute here saying that we shouldn't be taking these things, but it is known that antidepressant medicine is something that causes dryness of our mouth, our sinuses, our airways, and definitely our eyes. So again, in review, we talked a little bit here about the importance of bringing a thorough medicine list to your doctor, to your eye doctor here at Hazleton, Stroudsburg, and Pottsville Eye Specialists, so that we know what medicine you're on and how it's affecting your eyes. And we reviewed 3 categories of medicines: anti-allergy medicines, antihypertensives, and antidepressant medicines that can affect the overall comfort of your eyes and cause eye dryness. When we come back, we're going to talk about some different medicines and their effect on the back of the eye and glaucoma. Stay tuned. Hey everybody, Dr. Deom here. I am so excited. I'm showing you around our new office here in Pottsville. And you've seen every time you've turned the TV on here that I'm in a new part of the office, and it just keeps on popping up. It's beautiful. We love it. And here I am in our brand new optical with all of our wonderful frames behind us. A very open feel in here with lots of natural light flooding the room so that you can really get a great idea of how the frames and lenses look on you as you pick them out with you and your loved ones. So definitely check us out at our new location here, 541 West Bacon Street, Pottsville, Pennsylvania. Give us a call at the number you see on the screen. Don't forget, we're in Hazleton, Hazel Township, on 281 Airport Road in Hazleton, and in Tannersville, Stroudsburg Eye Specialists, right down the street from the outlets, right behind Friendly's. You can't miss us. Beautiful facility there. And so today we're talking a little bit about medicines and the way that they affect your eyes. And we had a conversation a little about the importance of bringing a comprehensive list of your medicines to your eye doctor. Why? Because it's so important that we understand not only what we're seeing when we look at your eyes, but why some of those things may be occurring. We regularly have phone call conversations with your primary care doctor. We regularly make appointments for patients that don't have primary care doctors. We regularly order blood tests, imaging studies like carotid Dopplers, chest x-rays, MRIs, and CTs based on your medical history. So not only what we see inside your eye, but also what we know about your health history. So having that information is extremely valuable to us, and we really appreciate it. So we talked about that. We also talked about the importance of knowing that certain medicines have effects on your eyes. And we talked about the antis. We talked about antihypertensives, anti-allergy medicines, and antidepressants and their potential effect on the lubrication and comfort of your eyes. So I would encourage that, if you've started any of these medicines, they're helping you, that's fantastic. You're noticing eye irritation, itching, burning, scratching, tearing, definitely make an appointment at one of our 3 locations to have that evaluated. Now we're going to talk a little bit more about some of the more obscure medicines that may affect your vision, things that you may or may not have heard of. One that has been, relatively well in the media, let's say lately, is Plaquenil and chloroquine and hydrochloroquine. And so these are things that you may have heard of, may not have heard of, but definitely has been in the media over the past year with the pandemic and some of the discussion associated with that. And so this is a medicine that's been used for literally decades for the treatment of malarial conditions and has been shown to actually help with some inflammatory conditions as well. So there are many patients with things like lupus and other rheumatological conditions that are taking Plaquenil. It's been shown that this medicine can actually cause relatively rare but very serious condition to the back of the eye or the retina, something called bullseye retinopathy. And so you could see a picture on the screen here of an eye that is the retina, and it looks perfect, very healthy. This is what it's supposed to look like. And here is a picture of the back of the eye with bullseye retinopathy. So certainly you could see in this picture, very obvious, you could see the difference between the 2 retinas, but really, really cool. We have some technology here, an OCT and something called an electroretinogram that allows us to pick up on that damage well before we see this type of difference between the two pictures that you see. So that's something that you should be aware of. If you or a loved one is on Plaquenil, it is standard of care that they get this OCT test, an retinal study, which again, we're one of the only ones in the area to have that, as well as a photo of the back of the eye to make sure that this is not occurring. One other relatively obscure, but pretty common medicine that many people are on is a steroid. So something that you probably all are relatively familiar with is prednisone, right? Prednisone is something that's used for a myriad of different conditions, mainly for the reduction of inflammation in our body, whether that's a systemic inflammation or an acute inflammation. Prednisone is often used, and so it might be something you're using long term, in the case of a systemic condition, or something you're using for poison ivy for a very short period of time. But it's well established and understood that long-term usage of steroids, whether it be oral in the form of prednisone, whether it be injected in the form of a medicine called triamcinolone, or even topical creams and eye drops, can increase the risk of eye pressure spikes. And so what we see here is a risk for a condition called glaucoma. So you may have heard me talking to you about glaucoma before. Glaucoma is a condition that causes decreased peripheral vision and damage to the optic nerve because of elevated eye pressures or a genetic predisposition to that occurring. So steroids are something that if you are on, you or a loved one are on, we should definitely be doing an eye exam to get baseline eye pressure tests and monitoring that over time. It's relatively uncommon, but it is something that we see and deal with probably on a weekly or bi-weekly basis that we can see, something like that happening. Something else that's relatively uncommon, actually extremely uncommon, however, still it's worth noting, and I think, we talk about these things, it gets people's attention, so I'm going to mention it. A medicine that you've probably seen advertised on TV, Viagra. So Viagra is a medicine that certainly is one of the highest grossing medicines in the world. It's relatively easily accessible now as well. Sildenafil acts on our vascular system for the treatment of erectile dysfunction. And it's been shown, although quite rare, could cause certain retinal vascular issues that can potentially be harmful and even dangerous for long-term vision. None of these things I'm saying are a reason to not, get these medicines or be prescribed these medicines, especially those for serious health conditions, but definitely something that I think it's worth knowing and being aware of. So that's why we're going over these things here with you today. There are some others. One that I think, is a relatively common medicine. Some of the migraine medicines that people are on, like Topamax or topiramate, that's one that I think is relatively common and can cause eye pressure increase through a very interesting mechanism of action that I'll save for when you come in for an eye exam and tell you all about it. The point of this discussion is this, and I could go on for days and days, paging through my notes here from optometry school, telling you about the various things that can happen as a result of taking certain systemic medicines and their effect on their eyes. The point is this, that our eyes are a dense network of nerves and blood vessels. And those nerves and blood vessels are affected by medicines that we take either orally or intravenously. And so if you are taking a new medicine, I think it's incumbent upon yourself to understand what it is that those medicines can do to your eyes and to your overall well-being, making it important to be able to read that little tiny package insert. I joke with patients all the time that me and the pharmaceutical companies are in cahoots because they make that print really small and then you think you need to come in for an eye exam. I'm just kidding. We really want you to know what's going on with your health, and that's why we go the extra mile to educate you about all these things. So if you haven't had an eye exam in a long time, check us out. We are at Hazleton. We're in Tannersville and now in Pottsville. We can't wait to see you. Have a great day.